Number 2, please name 3 potential high-risk bathers.
Intoxicated people, young and old should always be observed near water, and children who are unaccompanied by an adult.
Candidate number 2, please name 3 methods of entering the water.
One method is the shallow dive to get to the patient as quickly as possible. 2 would be a straddle jump to keep your head above the water and see that the patient gets rescued by yourself, and if the water is choppy. And then the 3rd one would be a side entry for the unknown depth of the water.
Candidate number 5, please tell us how we ensure safety in and around the pool.
Have the swimming pool walled off and locked. Have signs indicating the depth of the pool and the shallow and deep ends, and make sure there's always a lifeguard on duty supervising the swimming pool.
Candidate number 2 and 6 will now tell us about Dr. ABC. Candidate number 6, what does the D stand for in?
It stands for danger.
Candidate number 2, where do you check for danger?
Danger is anything that can hurt the patient, like electrical wiring, fire hazards, or anything that can hurt the patient.
Thank you very much. Candidate number 6, what does the R stand for?
R stands for responsiveness.
Candidate number 2, where do we check for responsiveness?
You tap him on the shoulder. Hello, sir. Are you responding?
Thank you very much. Candidate number 6, what does the A stand for in Dr. ABC?
A stands for airway.
Candidate number 2, where do we check for airway?
You do a head tilt chin lift, and you check the airway with a swipe of your finger.
Thank you very much, candidate number 2. Candidate number 6, what does the P stand for in Dr. ABC?
B stands for breathing.
Candidate number 2, how do you check for breathing?
Head tilt chin lift, and you check for chest rise and lowering of the chest, and also humidity that touches your cheek.
Thank you very much, candidate number 2. Candidate number 6, what does the C stand for in Dr. ABC?
C stands for circulation.
Candidate number 2, where do you check for circulation?
You check for circulation on the neck for a pulse.
Candidates number 4 and 5 are going to tell us about effective strategies that you need for CPR to be performed effectively. Candidate number 4, what do you need to do to ensure that CPR is effective?
You must make sure your body is perpendicular to the patient. It takes place in the middle of between the nipples, and your elbows must lock down.
Thank you very much, candidate number 4. Candidate number 5, anything else?
You have to lift the chin and clear the airway, and when performing the ventilations, the nose must be closed.
Why must the nose be closed, candidate number 5?
So that when the ventilations are being performed, the air doesn't escape through the nose.
Candidate number 4 and 5, the patient is unresponsive. There is no airway, there is no breathing, there is no circulation. Please begin with CPR. The patient is still dead, unresponsive. Candidate number 2 will now put candidate number 5 in the recovery position. Thank you very much, candidate number 2. Candidate number 4 will now demonstrate the vomit drill. Thank you very much, candidate number 4. Candidates number 2 and 6. How has CPR changed over the years? Candidate number 2.
Previously, CPR had 15 compressions and 2 ventilations.
Thank you very much. Candidate number 6, how is it now?
The method doesn't include the ventilations. It's mainly focused on the compressions.
And how many compressions is that?
50 compressions.
Thank you. Candidate number 2 is going to demonstrate a shallow dive entry with a cross-chest toe rescue method. Candidate number 5 is going to do a straddle jump with a chin head toe rescue method. Candidate number 4 is going to perform a slide entry using an extended toe to pull the injured person out of the water using an external device.
Calm down, I'm gonna hand you the ball. Hold the edge, you'll be safe.
Candidate number 2, 4, and 5 will now demonstrate treading water using their clothing as a flotation device. Candidate number 2, candidate number 4, candidate number 4, candidate number 5. Candidate number 2 is going to now rescue candidate number 5 using a land-based rescue method. In this instance, he's going to show us a demonstration with a rope.
Hold on to the rope tightly.
Candidate number 4 will now demonstrate getting a patient out of the pool using a rod, a swimming rod.
Hold on to the pool.
Candidate number 5 will now demonstrate using a pool noodle to remove a patient out of the pool.
Grab onto the end.
Thank you very much, candidate number 5. Candidate number 4 will now stabilize a patient who's got a neck injury. Thank you very much, candidate number 4. Candidate number 2 will now stabilize a patient who's also got a neck injury. Thank you very much, candidate number 2. Candidate number 5 will now assist a patient that's got a neck injury. Thank you very much. Candidate number 2 now demonstrating unassisted exit from the water with the injured patient who is conscious. Candidate number 4 demonstrating a cross-chest toe and is removing the injured patient out of the water. Candidate number 4 puts the patient on the edge of the pool. He's going to show him an uninterrupted assist to lift him out. Thank you very much, candidate number 4. Candidate number 4 is providing assistance to an injured, drowning patient. Candidate number 4 is also going to merge with candidate number 2 to give him an assisted lift, 2-man lift out of the water.